Gary.
Oh, we're recording.
Oh, well, that's fine. I can edit it out. Hi, everybody. We're checking up with Gary Castillo, one of our amazing tennis pros here at Johnson Ranch Racket Club. And he came in last week before a big tournament, actually, the same day of a tournament for some sciatica treatment. And how are you feeling now, Gary?
I am feeling much better. I do not have that shooting pain all the way down from my lower back to my foot, where my whole left side would give out with a sharp pain. That is gone.
Wonderful.
So I still feel the tightness in my lower back, though, in the upper hip.
Wonderful. And that's what we're going to start addressing today. One of the big parts of treating sciatica pain is actually treating the whole low back, which we didn't get to do last week. I didn't want to make big changes to Gary's body before the tournament because then your muscles perform differently. So today we're going to address the hip alignment and how the hips are affecting that low back tightness in his body. So Gary, if you want to go ahead and lay face up for me. Wonderful. Now just stay nice and loose, nice deep breath. Don't try and help me, okay?
Okay.
So first we're just going to grab onto the ankles and give some good traction in that low back and the hips and bringing those femur out of the socket. And as Gary stays nice and loose, I put my thumbs on his medial malleolus, the inside ankle bone, and bringing those together. And as you can see, my thumbs don't line up. We have almost an inch difference, short on the right side versus the left. So the first portion of that treatment is coming up underneath. And Gary, you don't help me, okay? You stay nice and loose. And we're bringing the knees up to the hips. And we're rolling it to the side that is long. And then bringing it back down. And then we come back down here. We do a nice little recheck. And we see we've got a big movement already from where we began. All right, Gary, and part of this hip alignment issue is the pubis bone. People tend to forget that our pubis bone is a huge part of our hips. We have our adductors attaching to that pubis bone, so we want to get that in alignment as well. So Gary, what I would like you to do is just close your legs onto my arms and give me some really good strength in there. Perfect. And then you just surprisingly let it snap together. And you do a recheck. And see, it's starting to come closer and closer together. All right, Gary, now I'd like you to go ahead and bend your knees. Keep the feet on the table. We're going to close your knees together, and I just want you to open your knees against my resistance. So for 5, 4, 3, 2, 1, and relax. This is still working on that pubis bone. Now, Gary, we're going to do the opposite now. I want you to go ahead and open. And you're going to come in against my resistance. For 5, 4, 3, 2, 1, and relax. Good. You doing all right?
I'm good.
How's your back feeling at this point?
Feels good, but I can definitely feel something in there versus 0 on this side.
Beautiful. Okay, now deep in the hip or in the glute?
In the hip.
In the hip. Okay. Right in here. All right, good. So Gary, now what I want you to do is drop those knees out, feet together. I'm going to put slight pressure here. I want you to give me a little bit of resistance coming into my hands. And I want you to slowly slide your feet toward the end of the table. All the way straight. Good. At every point, I always recheck and make sure we're getting progress. Come back. Don't help me. That's the important part. And we're getting really, really close. All right, so now we want to start addressing the anterior portion of the PSIS. So if you get a nice high view there, perfect. You can see where this left thumb does not line up with the right thumb. So his right PSIS is anteriorly tilted. So first we want to address that. One of the first things we want to address is our rectus femoris that attaches directly onto there, pulling that hip forward. So all these techniques right here are James Wisłowski's orthopedic and integrative manual therapy. And I put way too much oil on there. All right. Really light on the oil, really only need a few drops. And we start with just some myofascial release. Well, actually we call it myofascial spreading. So we're working against the grain. And then we're pushing at a 45-degree angle. We don't want to push directly down on the bone, pushing up. So, you know, a lot of the times what you really want to think about is we're lengthening that muscle back to a neutral state so we can get that PSIS back into a neutral position as well. So myofascial spreading. Is that okay, Gary?
Uh-huh.
Okay. Compression. It's all about that intent. Now what we do is called cross fiber gliding. And this is where we start going deep into that rectus femoris muscle right there. And we glide side to side and up, nice and slow. Paying attention to the client, making sure. Gary, are you okay?
I'm fine.
Okay, good. Good. And once we have that rectus femoris released, we can address that PSIS. All right, Gary, so what I'd like you to do is give me a little hula dance. You're gonna shake those hips up and down. Perfect. Now relax, and I want you to push up on your right side. So as they're pushing and I'm pushing down, giving that resistance on that PSIS for 5, 4, 3, 2, 1, and relax, and give me that wiggle again. Good, and relax. Now you do a recheck, and we can see that those thumbs are now aligned, that PSIS is aligned on both sides. Okay. So now we really need to start addressing some of the deeper muscles affecting the low back and the hip. Stay nice and loose. And if you want to come see this Quibus, the progress that we're making, I always check in and see where we're at. And we're getting down to just minuscule. That was what, maybe 1/8 of an inch difference now versus the almost an inch. All right, so inside our hip capsule is the iliacus muscle, part of our hip flexors, which when also is tight pulls our hip out, and it's also connected with our psoas muscle, which we're going to be treating both with what we call a pin and stretch. We get the pressure off those muscles by bending the knees, so when we go into the muscle, it won't be so intrusive. All right, Gary, what I would like you to do is take a nice deep breath and really slow on the exhale. And then as they're exhaling, you come right in onto that iliacus. You pin your fingers in and pull up. So pull up, pull superior. All right, Gary, what I'd like you to do now is slowly slide your foot toward the end of the table. And this is getting that pin and stretch. You give a little pressure on that femur, pulling it down, and exactly what Gary's doing is flexing that ankle to really get that stretch. How does that feel?
It feels great.
Good. And now let go and relax. Really important to try and get the client to relax and not have them help you lift their leg back up. So we want to get that usually twice is really where we want to do it. Nice deep breath. Slow on the exhale. So now we're going to get deeper into that iliacus muscle. Pin it, pull superior, and extend that leg and flex that ankle. and then let go. And then make nice. Now we're going to bring that leg back up again, because now we're going to go into the psoas muscle. And if you kind of take a look here at the belly button, we kind of use the belly button as the reference of the spine. Back there is where we start the L1, 2, 3, 4, and 5, all the way down to the S1. And so we've got our psoas muscle that it connects to all the L1 through L4, and it comes through our hip joint and connects to our femur. So it's a part of our hip extensors, and it's also a huge part of keeping our spine aligned in low back pain. So when we have tightness actually on Gary's right side of his back, but he's feeling it on his left side because that's where the major impact was happening. So now we're going to address the psoas on the right side. So Gary, we're going to do more like 3 or 4 nice deep breaths as I come in, okay? And always as they exhale, you start moving their guts aside. Nice and slow with their breath. Coming in at a nice angle where you're really going to be kind of pointing your fingers here to the femur and your arm or your hand into the spine. And a really great way to check and see if you've made it on the psoas is, Gary, I want you to bring your knee up towards your chest. And you would feel it pop right into your hand. I'm not there yet. So Gary, go ahead and put your foot down and give me one more breath. And I'm coming a little bit more medially there. Now go ahead and kick up again. And I can feel it pop right under my finger. All right, Gary, now I want you to go ahead and extend your leg again. But this time, we're not going to flex the ankle. What I want you to do is rotate your leg in and out.
Okay.
So what we want them to do is really rotate that femur medial and lateral. And how's that stretch feeling for that?
Awesome.
Okay, good.
Awesome.
Now, just for time purposes, we're only going to treat this one side on the video today, just to get that hip alignment. Okay, Gary, go ahead and relax. Great. So we're going to come back down and check and see where we're at. And we have still a little bit off. Well, that's because we still have a few more muscles that directly affect that hip alignment. So Gary, I'd like you to go ahead and roll away from me onto your left side.
Okay.
Go into basically a fetal position. And then you're going to scoot your hips all the way back to me until you can feel me behind you. Nope, nope, nope. Bring in the whole hips. Perfect, right there. Okay. Now we're going to straighten this top leg. Remember, his right leg was the one that was short. So that's the muscles we want to address first on that right side, lengthening that whole right side of the body. So you're going to go ahead and straighten that right leg and just let that hang right there.
Okay.
Now this feels like a really good low back
That feels great.
and hip stretch. Because the next muscle we're actually going to be addressing in this stretch and in this technique is the quadratus lumborum, which is it attaches on the PSIS and that last rib. Okay, that nice little circle right there. So first, we're just getting a little stretch. And you get one hand on that PSIS and one hand like right above the femur, and you get that stretch in the low back and in the hip. All right, now we're gonna get active about the stretch. All right, Gary, keep that leg nice and just relaxed, okay? I want this arm pointing toward the door like Superman, like you're flying. We want that nice long line. And I'm gonna give Gary a stretch here, pushing down on his leg. Now, Gary, I want you to push your leg up toward the ceiling, nice and light resistance for 5, 4, 3, 2, 1, and relax. And we get a little bit of movement there. Don't worry, I'm not going to let you fall, I promise. All right, give me a little bit more resistance again for 5, 4, 3, 2, 1, and let go. Good. We got a huge movement that time. And one more time for 5, 4, 3, 2, 1, and let go. Good. How's that feeling?
Awesome.
Okay, good. Go ahead and come back onto the table. Now we're going to get ready to turn you over and actually address some of those issues in the low back. Okay, go ahead and roll over for me, Gary, and here's the face cradle for you.
Okay.
Come over here. So the first thing we want to check is to see the alignment of that PSIS after that stretch. And we still have a little bit off on that right hand side of that PSIS. And you can just kind of feel for the hips, bringing it into the spine and really seeing where that alignment is. And it's not a huge misalignment currently. So we're going to address the little bit that's left. Really only a few drops. I use Cryoderm myofascial ointment. It gives a really good grip. All right, so we cross our arms. We've got one hand on the PSIS and one pushing the ribs, and we're spreading apart and really stretching and opening up the QL on that right side. Releasing some pressure on that spine. Pushing those ribs up. That PSIS down. And we come and recheck. And look really good. All right, so the next thing we want to check, come right behind me, Quibus, is we want to see if there's any tilt in Gary's body. So I want you to go ahead and stay here. Sometimes what you kind of need to do is just give a nice little check. Gary, don't help me. Stay nice and loose. And see if we have anything there. And it looks like Gary stayed nice and straight. Like we don't have one glute higher than the other. Last week we did address that and it stayed. And I'm very, very happy about that. All right. Gary, go ahead and roll on over and scoot down the table again.
Okay.
And what we're going to do right now is check his alignment. Now, one of the muscles we haven't addressed right now is the adductors, which is also a contributor. But let's see where we have him to. And we are almost perfectly aligned. All right, Gary, now we haven't addressed the tightness, but I want you to go ahead and get up and just take a little walk around the table.
Okay.
And see how your back's feeling currently. Notice your walk and...
Feels good. I don't feel any tightness. So I've been out on the tennis court for the last 2.5 hours and I had tightness, and at the moment I don't feel any.
And notice we barely touched the back. So how 9 times out of 10 when you have a chronic back issue, it really can be a hip misalignment that needs to be treated. So I want to thank you for watching and see you all next time.